Good afternoon, everyone. We are getting close to the end of the conference. What a wonderful 2 days it has been. But we still have time for a panel discussion, and we have 6 experts from various fields of science gathered here. I will introduce them shortly. But what we will try to address here, also at this panel discussion at the end, is the central question and theme of this conference. What is a psychedelic, or what is psychedelic? It's a multifaceted question that we can look at from many different angles, and that's why I'm very happy that you've all agreed to be panelists. So you've already met Dr. Marvin Singh, representing anthropology, I guess, from University of California, Davis. Dr. Aidan Lyon, Max Wolff first. Dr. Max Wolff, psychologist, psychotherapist from the Mind Foundation. Dr. Aidan Lyon, philosopher from Leiden University. Dr. Susanne Uusitalo, bioethicist, University of Oulu, right? Professor Eero Castrén, representing neuroscience, I suppose, from the University of Helsinki. And Professor Emeritus Hannu Alho, medical doctor, addiction specialist. I think I will start us off with some questions aimed at specific panelists, but you can, of course, feel free to jump in and comment on each other and try and get the discussion started that way. So if we get to the question of what are psychedelics, what's special about psychedelics compared with other things, maybe we can start at that end with Professor Hannu Alho. You lead a study on psilocybin-assisted treatment of alcoholism that we heard a little bit about yesterday. As a medical doctor and specialist in addiction medicine, what do you see as the major differences between something like psilocybin as a treatment and other pharmacological treatments? So if we think about psilocybin and psychedelics as psychiatric drugs or drugs for addiction, what's different about them?
Well, that's an important question, but difficult to answer. I had to say I don't know. I don't know because we actually are we sure what is a psilocybin-assisted treatment and therapy, and what happens in the brain and so on and so on. This is a new field, and we are kind of entering to this field to get more information and more knowledge and more research. So maybe I or someone can answer that in few years. But you referred also the other drugs or pharmacotherapies used in the treatment of alcohol dependency. And you are kind of giving a feeling that these psilocybin or the other drugs in this field, assisted therapies might be more powerful than what has been used before. We have no idea on this because there is no comparative studies. So we had to be careful when we are making any kind of conclusions here. We are doing a research on controlled, placebo-controlled clinical study, what is a large study, multi-center, multinational study, that will tell us something in 2 years. But so far, we are still kind of what has been done in the open studies.
Right, thank you. Maybe jumping on into the middle to Dr. Uusitalo, maybe a long question, but as a bioethicist, how do you see psychedelics differing from other psychoactive drugs? Are they somehow different in significant ways? Uses of psychedelic research, exceptionalism that's been discussed here at this event as well. Psychedelics are somehow entirely different than other drugs or the treatments. Do you think such accusations have merit when it comes to the ethical side of using psychedelics, for example? Is there anything that different about psychedelics, really?
Yeah, thank you. I think it's a good question, and I think that you can't have a single yes or no answer, because I think that psychedelics, they have, differences and similarities to other drugs to different degrees, of course. And you should be more precise on what substance you are comparing it to, and what are the things that we want to compare, whether it's about experience, whether it's about the mechanisms of the brain, what happens, and so what we want to answer, that what is the question in that. So in some sense I don't give answers, but ask what is the question.
Right. Moving to a very different context of use of psychedelics, if I may ask, you, Manvira, you talked about shamanism here today, shamanistic practices. If we look at that context, there's many different methods besides psychedelics, as you mentioned, in shamanism. Are there still some features differentiating psychedelics from the other methods in the context of shamanism, indigenous use? Are they just methods among methods, or is there something special or different when psychedelics are used specifically, rather than drumming and dancing and all these other things?
Yeah, so I would say there are two things that make psychedelics, I think, very special. One is just how powerful the experience is, and the second is how easy it is to evoke compared to other experiences. And so, like, the example that comes to mind is there are communities. So there's this great book called The Last Shaman, and it's about, I think, a group in Peru where shamanism was really related to lucid dreaming, and you had to really train yourself for a very long time to be able to do this kind of shamanic lucid dreaming. And then ayahuasca came in and it destroyed the institution, because you no longer need to have this very deep expertise and specialization. Suddenly everyone can have these powerful experiences. And I think that really reflects just how distinct it is in some ways. I mean, maybe not necessarily compared to other psychotropic substances of similar severity or similar intensity, but I do think it has distinct qualities that make it appealing for many communities.
Yeah. Moving over to, since we're talking about the experience part of it, moving on to Aidan, you've written some talks yesterday about psychedelic experiences without using psychedelics. Do you think there's something still unique that only psychedelics can achieve? Something that uniquely sets apart the states that psychedelics can occasion versus these other experiences like meditation and other routes to psychedelic experiences?
I wouldn't want to say that there's something unique about them, because I think that's probably too strong, but certainly something that's distinctive of them is the point that's just being made, that they're incredibly powerful. They're basically like spiritual or energetic bombs. I like the old analogy of psychotherapy. I think it goes back to Freud, of psychotherapy as being like you're working on an archaeological dig site and you're slowly brushing away and you're trying to figure out what's under the surface. It's really hard work, frustrating. And then what psychedelics, not always, but often seem to do is like they basically blow the dig site up. So you get to see everything that's under the ground very quickly, but you make a big mess in the process.
Yeah.
And that is not necessarily what happens, but I think it seems to be a pretty distinctive effect of psychedelics.
Yeah.
And that can be useful.
Yeah. Max, you talked yesterday about psychotherapy, about psychedelic therapy being just psychotherapy. Or am I overinterpreting what you said by the word just? You still seem enthusiastic about psychedelics. They have some. Do you think that psychedelics bring to psychotherapy that cannot be achieved by other means, perhaps?
Yes, I believe they actually do bring something to it. So it's not the same. Psychotherapy with psychedelics is not the same as psychotherapy without psychedelics. I would say it's augmented psychotherapy. And I can answer maybe with a more theoretical and also with a more anecdotal perspective. So anecdotally, I think what's very impressive is what we see in those patients that we treat with psilocybin. We treat patients with so-called treatment-resistant depression. They've been through lots of pharmacological treatments often, but also psychotherapy. And the patients who seem to, this is anecdotal, but the patients who seem to respond especially well to this treatment seem to be the ones who have previously actually also responded well to psychotherapy, but they were still depressed. People who say, I had a psychotherapy and I learned important things about myself, and I learned this and that, and some things changed, but I still have this depression. So those people seem to be the ones who really respond very well. And I see that as still anecdotal evidence of augmentation. I think the psychotherapy that these people have had still can become augmented years later by this treatment. And on a more theoretical point of view, I think we've heard about dynamical systems today, attractor landscapes with deep basins, with entrenched patterns that are hard to escape, and then psychedelics flattening the landscape and making it easier to transition between states, perhaps facilitating change. I think, by the way, I wouldn't always say that it has to be jumping out of one basin into another one, but it can also be facilitated movement along the slopes of a basin because it's not so steep anymore, and then you can gradually broaden it and shape it more differently. And I believe this context sensitivity or belief relaxation or flattening of attractor landscapes or whatever you call it, I think it's actually, again, not unique to psychedelics, but it could be something that is also a common factor of psychotherapy, becoming more sensitive to contextual information, loosening the grip on previous beliefs. And I just think that psychedelics are probably a very direct route to that. And that's why they work so well with psychotherapy.
Yeah, thank you.
Sorry for the long answer.
No, that's all right. And yeah, please do feel free to comment on each other or agree or disagree. But a question directed at Professor Castrén, Eero here at the end. Studies by your research group have recently suggested that these plasticity-inducing, maybe also antidepressive effects of psychedelics, they might work through similar mechanisms as typical antidepressant drugs, namely TrkB receptors, just much more effectively, or that's how I read it. Does this then suggest that when it comes to psychiatric use, psychedelics may just be super SSRIs, that this psychedelic nature and experience may not be relevant at all? How would you put this?
So yes, I mean, I think that this is the big question in the field right now. Can you split the psychedelic effect of psychedelic drugs into two different separate things, where you would have a psychedelic experience as one of the things, and then the medical type of things as the second. And actually, it is the medical type of things, antidepressant or anti-addiction type of effects, that kind of brought this new renaissance of the research recently. And so we're working in experimental models, so I think that you have to be careful about making too long leaps about that, but that may actually suggest, our data suggests that it may be that these two effects are separatable. And if they are separatable, then you have three possibilities from the point of view of these therapeutic advantages. The first one is that the psychedelic experience is absolutely necessary for these effects to occur. And that is, I guess, something that many of the companies that have now invested hundreds of millions or something onto these treatments are very keen on supporting this thing. And by the way, any scientific field where lots of money comes in becomes kind of convoluted. And I think that's kind of thing that psychedelic field is now experiencing. Then the second possibility is that the psychedelic experience is completely disposable. So you don't need that at all, and you could completely block that, and you can still get the antidepressant-like things. And then, of course, the third one is that there is some sort of mixture that in some cases, both of them are needed. In some cases, one of them is more important, and so on. And at the moment, we're just actually at the stage of you also saying that now we're just defining the questions. And this, I think, what we're doing now. We are defining the questions. What might be happening there in the brain, and if what does that actually tell us about what could be, what could be beneficial, what might not be beneficial. Comparing to different drugs, I would actually rather, I think SSRIs are in many ways, they have quite a bit differences, especially the slow onset of action, which I don't think that we understand at all why that happens. I think ketamine is much more sort of closer. How do you compare ketamine-mediated effects to psychedelics or psilocybin or LSD-mediated effects? And I think that is kind of more fruitful fruitful comparison. When we look at the mechanisms, they are similar. The affinity to TrkB receptor is higher for psychedelics, much higher. But otherwise, there are very much similarities there. So we will need to have better research methods and also perhaps compounds that would be more specific in order to answer these questions. And it will take certainly a couple of years before we have that.
Right. Yeah. Max, when you hear this idea that we could separate, take out the subjective experience and leave the plasticity, how would that affect the use for psychotherapy? Would you still like to use a drug like that for psychotherapy, which only had this plasticity effect? Would it be better, easier, or maybe worse?
Yeah, good question. I think somewhat ironically, probably the best use case for a non-hallucinogen psychedelic would perhaps be psychedelic therapy or psychotherapy, effective psychotherapy, because there has to be some beneficial learning context for positive change to occur. We cannot assume pure plasticity, if such a thing exists, to have a selective effect on positive things. It's perhaps a metaphor would be to try to do gardening with nothing but fertilizer and a wide-angle sprayer. So your roses have been overgrown by weeds, and then just put fertilizer over the whole place and see what happens. Yes, I think that we still need to think about a context and experiences that people need, even with non-hallucinogen psychedelics. Yeah. But I think I'm not opposed to developing these compounds, and I think these would be great tools to have, and especially also research tools to have. Yeah.
If we come back to Hannu, talking about these subjective effects, we think about them in relation to alcoholism. Some of the early LSD researchers thought that the very strong experience psychedelics cause might shock or scare alcoholics into stopping drinking. And more recently, we had this idea that spiritual, mystical type experiences induced by psychedelics, those would be central to people recovering from addictions. How do you see, based on this preliminary experience in your study, the role of the subjective experience in the possible anti-addictive effects? Is there something important about it, or do you view it as more as a side effect that you have to deal with?
Okay, interesting question. First, I will say that I completely agree with Eero about this, how we need to separate these different phenomena here. But going back to your question, you gave a very interesting presentation on this, and kind of comparing that heavy trauma or shock is very similar to a psychedelic experience. And how it works with the addiction. First of all, in our study, we don't have this kind of shocking experience. So in that respect, I cannot answer your question. But we know there is a research from the former Soviet Union using very shocking therapies in the treatment of alcohol dependency, like electrical shocks. That's shocks, like putting a person's hand in the bee nest and keeping it there for 10 minutes. And so I guess this was quite shocking experience for the persons, definitely. Okay, they stopped drinking, but they started drinking even more after 1 year. So it doesn't work. So does this indicate that this kind of shocking or heavy experience with heavy psychedelics is something different, what is not the curing compound when we think about the addictions and depressions?
Yeah. If you had to guess at this point, does the subjective experience make any difference? Would you rather not have it in your study, for example? Would you rather have this plasticity-only inducing drug for alcoholism?
Well, so far that's what we know.
Yeah. Right. Yeah, if we think about this subjective experience, things that can happen to people under psychedelics or after psychedelics, one thing that's been discussed here from many different angles is the fact that people can change in beneficial ways. They can stop drinking, or they can be healed from depression, and so on. But they can also change in other ways. Seems that people's worldviews, priorities, and values, and so on may change. And maybe these experiences cannot be properly explained to others or understood without undergoing them. So if we come to Susanne, if this is the case, then what does this mean for informed consent? If the person cannot really know what they're getting into beforehand, unless they've experienced it, and they might change, their worldviews might change, or their priorities or values. If psychedelics are used as medicines, what does this mean for informed consent?
So, at least in medical research ethics, informed consent is one of the key issues. Well, in research ethics, in any case, and it's worthwhile thinking what informed then means, because of course, if we are asking that people should have experience before going into, then we wouldn't be able to give informed consent to anything that we haven't experienced before. So of course that's not the case what they're looking for in the informed consent. Rather than they are sort of looking at what do they know about the things, and what potential there is for harms and benefits, what can happen. And of course this is sort of like if we have experiences that can't be described, how to put that in informed consent form in a way that the person then is informed enough to be able to consent voluntarily to a research. Well, it's a good question, and sometimes the thing is that it is similar, for instance, in phase 1 drug trials, when they are given a substance to a human being for the very first time. They really don't know what will happen. And still, it happens, and they get informed consent forms. They are just saying that, well, in animal research, this and this came up, but of course we can't say for sure whether that happens with human beings. And so the point is that to be able to give informed consent to a research where you're, having psychedelic drugs is not to have like a thorough explanation what will happen, but you need to have all the the harms, the risks, the harms, the benefits, what we know about that. But then again, this deviates now. What I'm going to say deviates about the traditional research ethics. I was just thinking about this undescribable experiences, and whether they would be sort of like, if we don't have concepts for them, if we don't have ways to describe them, what about simulating them in some other ways? So maybe not trying to put them in the informed context format, but rather finding new ways to gain that.
What could that be like? How could it be simulated?
I don't know.
That is a good question. If anybody has comments, Hannu.
Well, this informed consent is a very important question in clinical studies, and especially in the studies where you can have unexpected experiences. And for this study, what we are doing now, we don't ask the persons entering to the study, do you have previous experiences? No. And we don't encourage persons to have it in advance. And the informed consent describes very much in details what the person can expect to happen. And then we need to talk with the persons who are planning to come to study. Do you understand all this? Did you read it carefully? And so on, and sides. And then we have also a preparatory session by the therapist, preparing the person for this experience. So it's very, very important. And in many studies with psilocybin or other compounds like that, they have been kind of withdrawn by the ethical committees because the informed consent has not been truly enough. So, but it is kind of a complicated issue, but something what is possible to handle with the good planning.
Yeah. Do you want to continue? Yep.
Yeah, I will continue. I actually sit on the National Medical Research Ethics Committee, and I've read like hundreds of clinical trial informed consent forms, and evaluated whether I can make sense of them, because I'm sort of a layperson there because I don't have a medical background. But just to compare this. Whether you need to have experience in order to be able to fully give informed consent to a research. It's funny because I've done bioethical work on this heroin-assisted treatment, and the research on heroin-assisted treatment. And there, one of the objections for the persons to be able to give informed consent to the research was that they had experience from the heroin. Sure. So it needs to be in the context and compared with other cases that are similar but maybe different in some aspects. Yeah.
Right. In this sort of informed consent, in the case of psychedelics, should we tell people or inform them that their worldviews might change, for example, or that yes, you may be cured of your alcoholism, but maybe you might find that your job at the center of the capitalist machine is actually meaningless. We do see changes in these directions in people, so do we have to try and bring that into the informed consent? This is a slightly humorous example, but people's values may change as well, other values. Yeah.
Can I briefly? Yes, I think that should be stated there, that some people have experienced changes in values, in principles, and stuff like that. That is relevant information for people to then assess whether they want to actually go to the trial. Yeah.
Yeah. Max, psychedelics cause some really weird experiences that most people coming into psychotherapy are probably not expecting, and maybe in this informed consent they can have you might meet with a divinity. Do you consent to this possibility? We might have, if we tried to include all of the possible weird experiences, there would be a long list. But people might think about their problems from new perspectives, but they might have visions of some beings constructing pyramids and so on. Is it useful in terms of psychotherapeutic use that people also have these really weird, novel, surprising experiences, or is this a problem that we just need to deal with in the integration, for example? How do we deal with the weirdness in using psychedelics for psychotherapy? Do we need to tame psychedelics in order to use them for psychotherapy?
Yeah, I don't think it would be possible, probably, to take that out of psychedelics. It's at least hard to imagine. And I also don't think, again, that this is really a special thing of psychedelics, because people have weird experiences all the time. Between therapy sessions in the current model, with preparatory sessions and dosing sessions and then integration sessions. A little bit of what happens in normal therapy. I have a session and then I have a session next week. And between that happens experiences. And maybe the first session was preparation for that, and then the second session was integration. And also preparation for the next week. So it's not so different, and lots of weird things will happen in the meantime. Not so special.
Yeah. Man, we talked a little bit today about the kinds of experiences people might have in very different cultures with psychedelics and how they might differ and so on. But if we listen to the way we've been talking about psychedelics here and the way that the current scientific literature speaks about psychedelics, if we try to reflect that onto the sort of context that you've studied, talked about here, shamans, indigenous practitioners, and so on, using them in traditional context. What do you think they might be most surprised about in this discussion, and if they read the scientific discussion currently about psychedelics, like a Shipibo shaman, you know, what would he most disagree with about how we're describing and talking about psychedelics? What do you think?
Yeah, that's a good question. I think a Shipibo shaman is kind of an interesting example.
Maybe not the best example, right?
Yeah.
Right.
But well, okay, so two come to mind off the bat. One is the model for how they affect their healing, where it's about enhancing individual psychological malleability. It's overwhelmingly a cognitive mental model rather than one in which psychedelics are vehicles to access special powers and engage with supernatural beings to serve instrumental ends. So I would say that's a big one. The other one that I think would be quite important is the overwhelming focus on, and it follows from the first naturally, is the overwhelming focus on patient consumption, that psychedelics affect change, that they heal by people consuming them and having these powerful experiences. In particular, and not even necessarily experiences in which they are seeing witches and battling with them, or learning about the source of an illness, for example. I think it's a very different kind of biomedical model, and I think in both instances it just reflects the overwhelming schema that different peoples have for illness. I think I was talking to someone previously where even outside of psychedelics, if you compare what people in, for example, Salt Lake City go to neo-shamans for compared to what the data I have in Mentawai for why people go to shamans in Salt Lake City, it's like anxiety, depression, fighting with my mom, etc. In Mentawai, it's like symptom-wise, it's physical illness. We live in a society that is much more cognitive, that kind of frames illness and affliction, especially this kind, in a cognitive way, and I think that manifests over here.
Yeah.
Not to deny its efficacy, the efficacy of psychedelics in affecting behavioral change.
Yeah. Maybe trying to pivot back to the concept and word psychedelic. Aidan, you talked quite a bit about what is psychedelic in the sense of mind revealing, right? Do you think psychedelic experiences involve other aspects apart from revealing your own mind? Especially this question, do psychedelic experiences involve learning something new, learning new knowledge? Can you learn something new about the world or apart from your own mind through psychedelic experiences?
So I use the word mind just because that's given my primary audience for my kind of work is people working in cognitive psychology, science, analytic philosophy, and so on. But there's more there. Like the term psyche has been interpreted and translated in different ways, right? So there's also been interpreted as the soul. Right? So then psychedelic experience would be a soul revealing or soul manifesting experience. Same for the self or spirit and so on. But then also, I think sometimes something that gets neglected about is the body, right? Because a lot of these extends of awareness into the body, becoming more embodied. And for a lot of people, especially in our culture, and especially as academics, I'll just speak for myself, as a philosopher over the years, you basically implicitly encouraged to be you treat yourself like a brain in a vat. You're at your computer, you're typing, and that's what you do, right? and you're dragging your body around to get from conference to conference. That's its purpose, right? But it's such a narrow perspective of the body. There's so much information in here. There's so much going on all the time. So just being able to expand your awareness into your body and just be aware of all the signals that are going on, and all the ways you can use your body to think and innovate. I think for a lot of people that counts as new information.
Yeah.
Yeah. So
New information about your body. Do you see that in your psychotherapy trial, for example, do you think? New information about knowledge about something else than your own mind. The body, for example?
Remember the whole Max Wolff.
Good question. Is it off now? Hello? It's off. I switched it off. Yeah. I would just give a book recommendation. Chris Leatherby's Philosophy of Psychedelics. I've seen it on a table there.
Yeah.
I don't know. Probably there's just one exemplar here, but it's the focus of this book is one of the foci of this book is knowledge that can be gained, different kinds of knowledge that can be gained from psychedelics. Very insightful. Yeah, that's my recommendation.
Right. Coming to what makes psychedelics psychedelic, or whether we should call them psychedelics, Eero, is there, from your perspective, is there something else that's interesting, unique, or special about classic psychedelics, apart from the fact that they cause these strange subjective experiences? Like, if it turns out that the subjective experience is irrelevant to their use as drugs, if it would be best to block them during treatment, then what are the psychedelics anymore? How should we then view and understand them? Some people have suggested the term psychoplastogen. Is this a useful or meaningful term, or is a non-psychedelic psychedelic a reasonable term?
Non-psychedelic psychedelic. Well, I mean, as I said before, we're in the very early stage now, and David also has introduced this psychoplastogen term. We'll see whether that sort of catches up and how some of these compounds that they are now testing turn out in trials. But what I should is, if you want to produce like change in, you want to stop addiction to alcoholism, or you have a depression and you want to recover from that, that entails a change. And a change is something that you can kind of help or you can facilitate. And that's what antidepressants are supposed to do. And then, whether this is an SSRI or whether this is a psychedelic or whether this is a ketamine or something, then this, in the end, we came to the same thing, is that these compounds themselves are not going to produce the change for you. You will have to produce the change for you. So by changing the way that you act and then in your presentation you mentioned that plasticity is a double-edged sword. So it is not something that is automatically beneficial for you. If you are in a plastic state when something bad is happening, then that could be bad for you. And that, I think, is very, your talk was sort of illustrating this when, if we know that trauma and the consequence of trauma of acute trauma into the PTSD-like symptoms does involve plasticity. And that is kind of negative outcome of plasticity. And it's kind of understandable evolutionary. If you experience something, if you put your hand onto a hot plate, you would actually want to learn it from once. I mean, you don't want to do that 10 times before you learn that it's not a good idea for you. So there is kind of very strong learning of traumatic experiences. But that also, again, is kind of an outcome of plasticity. And that's why I think that what else do you do except taking these compounds? I think that is really the critical issue here. And I think that this is why the fast-acting antidepressants, that ketamine and psychedelics are, because you can now, the problem with SSRIs is that in some cases it may take, 2 weeks and sometimes 4 weeks, or sometimes they don't work at all in some people. And then you don't know when is it that you would kind of administer or give the sort of psychotherapy or whatever you give at this stage. But then it's much easier with the fast-acting, because you know that if you now give this drug, you would have this window of plasticity for days or maybe 1 week or 2. Then you have to act at that time. And I think that this is going to be one of the big problems for the profession of psychology and psychiatry, that are kind of slow sciences. They are used to, like one of my colleagues, the psychiatry colleagues, says that psychiatry is a science that you can best describe as wait and see. But now, this new type of psychiatry, where you have compounds that can open up plasticity or facilitate plasticity, and then you need to act on that at the time that they are open. That makes it different kind of treatment. You have to think about what you do, and you have to put that all together in a few days. And I would like to again emphasize, it's not automatically good for you. It can also be bad for you if you don't take care what happens there. So I think that this is, from that point of view, I think when you were asking whether SSRIs, these psychedelics are just another SSRIs, in a sense, yes, they are. In as much as they facilitate plasticity, then you need to combine that with supportive treatments that help people producing the change. And you have to want to produce a change. If you don't want to if you don't want to stop drinking, you won't stop drinking. That's an important point. Motivation needs to be there as well.
Right, thank you. Hannu.
Yeah, again, completely agree with Eero. And this is very important that we have the window of the change, and we need to see that, however it's produced. And I always, maybe a little bit too much simplifying, but I always tell to the patients when I'm talking with them about how you can get control on your alcohol dependency, that currently there is no wonder drug to cure you on your alcohol dependency. And probably there will be not a wonder drug what will cure you. It's you need to do the change. So if just by taking a drug, whatever, doesn't cure anyone, you need to have the change, you need to have the motivation, and that's what we are probably doing here.
Thanks. Aidan.
Mind revealing.
Max, what is a psychedelic?
I suppose I just have to can agree with you, Aidan. Or lack of a better answer.
From a global cross-cultural perspective, what the heck are psychedelics?
Supernatural beings creating pyramids. to quote a wise man.
Susanne, what are psychedelics?
I would need to have that in a context, because I think that the conceptualization of what we are trying to understand has ethical implications.
Eero, what is a psychedelic?
Psychedelic is a compound that produces psychedelic experience. That's what I think. And
Hannu, do you agree? What is a psychedelic?
Again, agreed.
Thank you all very much.